In this video, I want to talk about sacroiliac joint fusion. What is it? What are the risks? What are the symptoms of sacroiliac pain? The sacroiliac joint is the joint between the sacrum and the pelvis. All of our body weight is transmitted when we're standing and moving and walking through the two sacroiliac joints. The joint is supported by a ligament or capsule, and if there is an injury to that capsule, for some reason, the joint becomes unstable and possibly painful. Women that have had babies know a little bit about sacroiliac pain because the hormones associated with pregnancy, in order to allow the baby to come out, loosen the joint and it becomes lax, and they can have sacroiliac joint pain. Patients that have an injury to the joint, chronic laxity, a variety of other reasons, can have sacroiliac pain. And in some patients, we recommend a fusion. Typically, if they have the right constellation of symptoms, the diagnostic injections have been positive, and they failed non-surgical treatment, which would be about 6 months of physical therapy, medication, maybe some injections, etc. The surgery is done under general anesthesia. The patient's asleep. We make a small incision on the side of the hip. It's about 3 centimeters. And then under X-ray, we put a pin across the joint. And then we create a channel for the implant over top of that pin, and then put the implant in. Now, the implant I use is iFuse. It has the strongest literature support in the research and is one of several implants now on the market. But it's a triangular shaped 3D printed implant. Once it goes into that cavity that's been created, it really stays there. It provides immediate stability to the joint, and it adheres to the bone relatively quickly. We typically put in 3 implants at different places in the joint. Sometimes we can only fit in 2. The surgery takes about 20 to 30 minutes and is associated with a minimal amount of bleeding. The main risk of the surgery is that the implant's placed in the wrong place, and it could affect a nerve or rarely a blood vessel. So we try to correlate the imaging, like a CT scan that was done before surgery, and the X-rays that we see at surgery with our understanding of the standard anatomy. The rate or the likelihood of placing the implant in a bad spot is really quite low, less than 1%. The other risk of the surgery is fracture. So we could cause a fracture of the bone when we put the implant in. Fortunately, this is also uncommon and typically just leads to some additional postoperative pain, but no additional surgery. The patients after surgery used to be recommended to be non-weight bearing for like 3 weeks. The recommendations have become more liberal over time, and my recommendation has been to be mindful of your movement, to be walking, and to take it easy. You're not going to hurt the fusion with movement, but the patients get fairly sore after surgery if they're really active, because we've made a channel through the muscle, and that muscle can just be irritated and spasm with a lot of activity. So just pay attention day to day how you're feeling after surgery. Ice, a little bit of NSAIDs like ibuprofen, naproxen, Celebrex, a little muscle relaxant, maybe tramadol or a small amount of oxycodone are typically used to manage the postoperative pain. The recovery from this is typically about 3 to 4 weeks. And again, the incision is small. The risk of incisional issues is relatively low. Sacroiliac joint fusion is a successful surgery for the management of sacroiliac pain that's not responsive to non-surgical treatment. The benefit in the literature, or the success rate in the literature and in my own practice, is about 80% in the correctly selected patients. The main risk is that the implant affects one of the nerves in the sacrum, and the risk of that is very low. The patients generally are satisfied with the operation, and again, that recovery period is about 3 to 4 weeks of being pretty achy and sore, and then after that, the symptoms improving with time.